someone in your life have mold illness? Here's what you need to know. Hey guys, I'm Dr. Martin Hart here with Keystone Total Health. If someone in your life has mold illness, you're here to learn a little bit more about that, and I'm proud of you for that. But maybe it can be confusing because you don't feel like you were affected by it, but they seem to have such a strong reaction. Maybe even told you can just wipe it down with bleach. Won't that just solve the problem? I want to address each of these questions. But first, let's understand a little bit about mold illness and how it affects you and your family members' health. Mold is a silent killer that affects us in three major ways. It's an allergen, it can be a toxin, or it can be an infection or an infestation where it actually colonizes inside of our body to live, grow, and then take over. Mold affects each of us differently. It might affect you differently than it affects your spouse or your kids or a family member or a friend. Now there's many reasons for this. One of them can be genetics. About 25% of the population has a mold gene called HLA-DR. Now what that one does is if you have that gene issue, it makes it very difficult for your immune system and detoxification pathways to deal with mold. So instead those toxins and those mold spores just accumulate inside of you. You can have other detoxification issues. You could have a poor immune function, right? Any of those things are going to affect how well you deal with and handle mold. Now, one big benefit for being an adult male is testosterone makes us a little bit more resilient to that mold. So women and children a lot of times have a harder time, but that doesn't mean it won't affect men as well. Mold illness can look like so many different things, right? It can look like allergies, runny nose, red eyes, congestion, cough. It can look like bloody noses. It can look like seizures, anxiety, depression, brain fog, cognitive issues. It could be joint pain. It could be abdominal issues like irritable bowel syndrome, food sensitivities, right? They call it chronic inflammatory response syndrome for a reason. All the inflammation it releases inside the body. It causes menstrual cycle dysregularities, difficulty getting pregnant. It can cause hormone problems in men, right? For children, it can stunt growth. It causes a huge array of these issues. So a lot of times we're missing it because all we're looking for is maybe a cough or a runny nose or sneezing, but really we need to be looking in the whole body. So I just want to help you understand that you can see how far widespread that the mold illness really is inside someone's body. You might think, hey, this person just has headaches, or hey, this person just has hormone issues, or they just need to eat better, right? Or they just need to toughen up, they're a little too sensitive. But the reality is that mold is affecting them differently than it may be affecting you. I really want to drive this point home, that just because you don't feel bad doesn't mean it's not affecting you or it's not affecting one of your family members. Remember, I called it a silent killer. That means a lot of times we don't know it's a problem sometimes until 3 or 6 months, sometimes even 5 years down the road. For instance, did you know that many mold toxins are a carcinogen? Now that's a big fancy term for causes cancer. Right? Now this has been proven out multiple times in the research that mold can trigger cancer. So if you're going, I have no idea why I got it, you may need to look at mold. It can also contribute to autoimmune conditions, neurodegeneration, other immune infections, for instance, Lyme disease. Mold can lower your immune function, leading your Lyme disease to either become active or make it easier for you to get it, right? And so if you're not looking for these things, mold may be driving it. I've seen mold drive developmental delays, learning disabilities, ADHD, all from a toxin in the brain caused by something you're breathing into your house that you maybe think is just a little musty, just a little bit of mildew. But those are toxic things. That mold is trying to take over your home, trying to take over your body, because that's what it does in nature. It breaks things down, it takes over the area, right? So that happens to us too. I'll keep repeating this. Mold affects each of us differently, and so we respond differently to it. So just because you're not affected doesn't mean other people in your lives may not be very, very strongly affected by it. Okay, so now that you know just a little bit about mold toxicity and mold illness, what do you need to do? Step one is always test. You need to test your home to see if it's moldy, okay? So before you go wiping everything down with bleach, test. You can do the ERMI testing. You can do some plate testing as an intro. I highly recommend that you speak to a healthcare provider who's well trained in that. Here at Keystone Total Health, we specialize in dealing with mold and mold illness. So feel free to reach out to us, but you need to be speaking with someone when it comes to testing. And then you can be testing the body, right? Do you have mycotoxins? How's it affecting you? Is it causing inflammation? You can look at all of that through laboratory testing that will help you identify the root cause of what's going on. Now, can't you just wipe it down with bleach? Mold is a little more pervasive than that. So mold is hiding. If you're seeing it, it means it's hiding somewhere deeper. It's like a weed. There's roots deep into the home somewhere. So if you just clean it with bleach, number one, you're going to spread all those spores and mycotoxins out when you go messing with it. Number two, you're not actually dealing with the root. Okay, that mold is somewhere else. If you're seeing it, it means it's really bad. And so you need to figure that out through testing where it's at. Once you identify the mold, I do not recommend you go trying to remediate yourself unless you have experience doing so. There's steps you need to follow, right? You need to siphon off the area so the mold spores and the mycotoxins don't spread. Create negative air pressure. Use an air scrubber. Do small particle cleaning. Remove all the contaminated components. If you're not doing those things in the right way, then don't just go hodgepodge, because it's really going to cost you more time, energy, and money in the long run, and it's going to make your family member potentially sicker. So make sure you know the steps. So test, don't guess, don't assume, please. Number two, clean it up the right way. I hope this is helpful. I look forward to any questions you guys might have. Share it if you know someone who needs this. Take care, everyone.